When the kidneys aren't effectively doing their job, the repercussions can manifest in various ways throughout the body. Here, we will explore the top 5 warning signs that may indicate improper kidney function and tips to mitigate potential damage. Being aware of these vital signals can empower you to proactively monitor your health and determine if steps should be taken to prevent further harm. Early action secures the best prognosis, so let's dive into the key symptoms to monitor that could mean your kidneys need assistance. 1. Swelling in legs or feet. Swelling or edema in the lower extremities is a hallmark sign that fluid regulation is irregular, often stemming from impaired kidney function. When the kidneys can't adequately filter blood and remove extra fluid, it begins to accumulate and pool in the legs and feet where vessels are most ostensible. This manifests as puffiness, heaviness, and protruding ankles. As excess fluid builds up, it also raises blood pressure and stresses the cardiovascular system. Chronic kidney disease and end-stage renal failure frequently cause such swelling as waste metabolites back up. The swelling itself can cause discomfort, impaired mobility, body image issues, and injuries. Prompt diagnosis is key to pinpoint the underlying kidney dysfunction, spurring fluid retention and associated hypertension. Dietary changes, fluid intake monitoring, medication to spur urine output, or even dialysis may be warranted to alleviate swelling and prevent permanent damage if kidney function decline is caught in time. Ignoring persistent leg, ankle, or foot swelling can allow fluid levels to spiral and risk heart strain. So physicians urge patients to schedule an appointment as soon as swelling rises. 2. Fatigue or weakness. Relentless tiredness and lackluster energy levels often indicate the kidneys need assistance. Waste toxins build up in the blood when kidney filtration capacity falters. Toxins then permeate cells, impairing cellular respiration and oxygen uptake. Without sufficient oxygen, cells quickly become exhausted. The accumulation of uremic toxins can also suppress appetite and drive nutritional deficits, depriving the body of fuel needed to generate vigor. Anemia, or insufficient red blood cells that commonly accompanies advanced kidney dysfunction, due to impaired erythropoietin synthesis, can further accelerate fatigue. Patients battling kidney disease report difficulty concentrating, muscle weakness, diminished motivation, and depressing mental fog. Checking for elevated toxin levels, anemia markers, and mineral imbalances aids diagnosis of any renal issues that could underlie severe, stubborn fatigue. Identifying and addressing the root kidney problem helps restore energy, outlook, and quality of life. If caught before exhaustion becomes chronic or debilitating, patients feeling constantly depleted should proactively consult their physician. 3. Nausea or vomiting. When kidney function falters, uremic toxins and metabolites accumulate and circulate rather than efficiently filtering out in urine. These byproducts can profoundly disrupt gastrointestinal functioning and chemically stimulate the vomiting reflex. The toxin buildup irritates the stomach lining, provoking sensations of discomfort, queasiness, and urging to vomit. As toxin levels rise and linger, nausea and vomiting can become intractable even without intake of any spoiled foods. Vomiting leads to further dehydration and electrolyte imbalances, as fluids and minerals essential for proper nerve, muscle, and enzyme activity are involuntarily expunged. Potassium, among other key electrolytes, may fall to dangerously low blood levels. Dehydration coupled with biochemical instabilities then fuels cycles of amplified vomiting symptoms. The unrelenting nausea can depress appetite and lead to detrimental weight loss as food intake decreases. Screening patients presenting with unexplained and frequent nausea or vomiting spells for underlying renal issues is paramount before permanent gastrointestinal damage sets in. Timely treatment of the kidney problems relieves the nausea genesis. 4. Change in urine color or frequency. Variations in urine color, texture, or output volume alerts patients and physicians about possible kidney impairment or health conditions affecting renal functioning. Dark yellow, brown, pink, foamy, or frothy appearing urine indicates concentrated waste products the kidneys failed to filter out. Toxins like urea, creatinine, and uric acid build up, rather than exiting the body as designed. Patients may pass much less or more urine than usual based on the kidney damage type and severity. For example, marked urine frequency and urgency signals diabetes and cited bladder inflammation. Grossly reduced urine output accompanies acute kidney injury or chronic decline in nephron filtration capacity. Pinpointing the causative condition like dehydration, infections, kidney stones, or congenital defects allows proper treatment to restore normal urination patterns and protect kidneys over the long term. Simply monitoring voiding frequency and visual urine characteristics provides vital clues something is amiss. Patients are urged to record and report any unexplained, prolonged changes in urination to their doctor for further evaluation. Timely intervention can profoundly impact prognosis. 5. Itchy skin. When kidneys falter at filtering blood, waste toxins permeate veins and accumulate under skin layers, triggering inflammatory and allergic-like reactions. Pruritus, severe itching, ensues which can profoundly disrupt patient quality of life. The toxin-damaged skin turns dry, scaly, and intensely irritated. Some patients develop painful rashes, welts, or hives exacerbating the urge to scratch. But repeatedly scratching further inflames and infects skin. The inflammatory nature of kidney-rooted pruritus makes it highly resistant to anti-itch creams, antihistamines, and home remedies. Areas with thinner protective outer layers like the back, arms, legs, and head tend to itch most severely. However, the pruritus can spread everywhere. Relentless itching robs sleep, productivity, and sanity without treatment of the underlying kidney dysfunction. Anti-itch steroids may provide temporary relief while physicians address kidney problems to reduce systemic toxin accumulation. Kidney transplant or dialysis filtering toxins out may address pruritus resulting from end-stage organ decline. Seeking dermatology and nephrology consults early when facing chronic cases prevents the itch scratch cycle from devolving into self-harming skin mutilation and despair. In summary, swelling, fatigue, nausea, urine changes, and skin itching can indicate kidney distress. Patients exhibiting these symptoms should promptly consult a nephrologist for assessment. Annual checkups equally aid early detection before damage becomes irreversible. Several lifestyle changes proactively safeguard kidney health: staying hydrated, controlling blood pressure, maintaining a nutritious diet, avoiding toxins and over-the-counter medication overuse. For the latest kidney health advice, subscribe and comment below. Together we can spread awareness, speed diagnosis, and preserve kidney function worldwide. Action must be taken both individually and collectively to prioritize this vital organ. Our quality of life depends on it.